Okay. Good morning, students.
Good morning, ma'am.
Can you hear me?
Yes, ma'am.
Okay.
Yes, ma'am.
So today we will be discussing on the topic this hemorrhage. Okay. First aid theory. So please check out your copy. First aid theory. Okay, so we will be discussing regarding the topic that is hemorrhage. So do you have any idea? Any idea what is hemorrhage? Anyone?
Damage, ma'am.
Pardon?
Bleeding, ma'am.
Yes, from this. Okay, hemorrhage means bleeding. Okay, the other name of hemorrhage is bleeding. So you can like write it down. Okay, hemorrhage means bleeding. Okay, done.
Yes, ma'am.
Okay, so can anyone tell me what is hemorrhage? Means what will be the definition of hemorrhage? Anyone? Anyone?
Release of blood, ma'am, from the body.
Oh, okay. Okay, it's almost correct. Okay, so let us discuss hemorrhage. Okay, so this is how the bleeding occurs. Okay, this is the bleeding that occurs from your arteries. This is the bleeding that occurs from your veins, and this is the bleeding that occurs from your capillaries. Okay, so let's see what is hemorrhage. Okay, so hemorrhage, which we also call it as bleeding. Okay, this is the flow of the blood from an artery, veins, or capillaries. Okay, now if the blood flows from our arteries, from our vein, or from our capillary, then we call it as bleeding. Are you clear? Are you
Yes, ma'am.
clear? Okay, all of you, I guess you know what is artery, what is vein, what is capillary. All of you know, right? What is artery, what is vein, what is capillary?
Yes, ma'am.
These artery, vein, capillary, these are the like blood vessels, okay? Or there is also like another definition, that is bleeding is the escape of blood from the blood vessels, okay? That is, it may be from the artery, it may be from the vein, or it may be from the capillary, okay? So bleeding can be both internal bleeding as well as external bleeding, okay? Internal bleeding means the bleeding that occurs internally, अंदर से जो bleeding होता है ना, from inside. So that is known as the internal bleeding, and the external bleeding, the bleeding that occurs outside, okay? Outside the surface, so that is known as external bleeding. So in external bleeding, the blood will escape, that means the blood will flow, okay? The blood escape the body through a surface of wound, means through the cut or through the surface of the wound. From that itself, the blood will escape or the blood will flow, okay? So that is from the outside, which is called external bleeding. And the other one is, in internal bleeding, the blood will escape from tissue inside the body, okay? The blood, that means the blood will flow out from the tissue, that also not outside, inside the body. So that is the meaning, or that would be the definition of hemorrhage, or which we call it as bleeding. So are you clear?
Yes, ma'am.
Okay. Okay, next. let us discuss about the types of hemorrhage, okay, which is also known as types of bleeding. So there are 3 different types of hemorrhage, okay, or bleeding. So the first type is arterial bleeding. That means the bleeding that occur from the arteries. So this is, you can see the picture here. This is here, these are arteries, okay. This is how the bleeding occurs, okay, from our arteries. So you can see this it sparks out like this, okay, the arteries one. So in arterial bleeding, the blood is bright red in color, okay. It is not dark, okay. The color of the blood is bright red, bright color. It's blood bright red in color, and it's sparked with each heartbeat or at its this contraction, okay. And the flow is also pulsatile. So what do you mean by spurt? S-P-U-R-T-S. S-P-U-R-T-S. Anyone? S-P-U-R-T. Anyone? Jiban, what is S-P-U-R-T? Spurts? It spurts with each heartbeat, right? Or at each contraction.
Coming out forcefully, ma'am.
Yes, coming out forcefully. Very good. It will burst, or it will like the blood will like splash, okay. The blood will burst suddenly. It will move with very speed, okay. You can even see in the picture also here. This is how the bleeding occurs, okay. The arterial bleeding occurs. So this is what we call it as spurt. It's spurt with each heartbeat. So with each heartbeat, it will spurt out like this, because it is the bleeding. It is the arterial bleeding now. So that's the reason why it will spurt out, okay, with each heartbeat. Or at each contraction. Contraction means each heartbeat and each contraction is same thing. So in case if you don't understand with each heartbeat, so I have also mentioned this at each contraction. So each time it contracts, okay, each time it pumps or it contracts, that in that case, what happens is that it will spurt out. And then the flow is pulsatile. So the flow is pulsatile. What do you mean by pulsatile, Samson? Samson?
Yes, ma'am.
What do you mean by pulsatile? The flow, because if there will be bleeding, then there will be a blood flow, right? So here it is written that the flow is pulsatile. What is pulsatile?
Pulsatile means through the pulse veins, I think.
The flow is pulsatile. It means like the flow is pulsatile means like will the flow of the blood be very rapid, or it will be very steady or slow?
It will be rapid, ma'am.
Yeah, it will be. That is pulsatile. It indicates that that meaning, okay. That meaning indicate for this particular term, okay, in this case. So the flow is pulsatile. That means the flow will the blood flow will be very rapid. So these are the symptoms you could see, okay, when there is an arterial bleeding. And you will again find for the like venous bleeding different, and again for the capillary different. So try to know how to differentiate it, okay. So this is the first types of this hemorrhage. So coming to the next type, that is the venous bleeding, okay. The venous bleeding means the bleeding that occurs from our vein. So here, before if the bleeding occurs from the artery, then what happens is that the blood was bright red in color, right? So, but in case of the venous bleeding, if the bleeding occurs from our vein, then the color of the blood is dark red, and it does not spurt. So in that case, it's not it bursts out or it splash out. It's not it. But whereas in case of venous bleeding, it does not spurt. That is the difference between arterial bleeding and venous bleeding. Next, steady flow. Steady flow means low flow. Okay. Before you have seen now in arterial bleeding that the flow is pulsatile. The flow is very rapid. But in case of venous bleeding, you could find that the flow of the blood is very steady, very slow. So this is our vein, like this is our vein, and how the bleeding occur. This is how the bleeding occur. The picture can like explain everything. See, this was the arteries, right? It's sparked out, and this is the vein. See, it doesn't spark out like that of the arterial bleeding. Can you differentiate the difference?
Yes, ma'am.
Yes, ma'am.
Okay, okay. It's very simple. Okay, then let's move on. The next is capillary bleeding. So in capillary bleeding, the bleeding will occur from your capillary. Okay, this is the picture from your capillary. The bleeding will occur from your capillary. So the bleeding from the capillary occur with any wound. Okay, so in any kind of wound or in any wound, the bleeding occur from our capillaries. Okay, so here the color of the blood will be neither bright neither dark. Okay, it will be normal. So the blood is red in color. It will be simply red in color, and it does not spark like that of the venous bleeding. Okay, in the capillary bleeding here also we will find that the blood the blood flow does not spark, and then slow but even flow. Here in the venous bleeding, the blood flow was also slow, but it was not that slow as compared to that of the capillary bleeding. Okay, so it is slow but even flow. It is very slow, but it keep on flowing. You could see here it's like the droplets of water. Okay, it flows like a droplets of water. So you understand what are the types of hemorrhage or types of bleeding?
Yes, ma'am.
Yes.
Okay. Okay, so now let me revise, okay, whatever we have discussed about the hemorrhage, because in your syllabus we could find only the two topics, right? One was the what is hemorrhage, and the other one was the types of hemorrhage. So let us revise whatever we have discussed. That is, what is hemorrhage? Hemorrhage, we call it as a bleeding also, and it is the flow of blood from our blood vessels, that is maybe from the artery, from the vein, or from the capillaries. Or the other definition is that the bleeding is the escape of blood from the blood vessel. Okay, in external bleeding, your blood escape the body through a surface wound, whereas in the internal bleeding, the blood will escape from the tissue inside the body, not outside. And the other one is the type of hemorrhage. We could find the three types of hemorrhage. So the first type is the arterial bleeding. So in arterial bleeding, we could see that the blood is bright red in color. It's sparked with each heartbeat or at each contraction, and the flow is pulsatile. Whereas in the venous bleeding, we could find that the blood is the blood is not bright. Okay, it is the dark red in color, and then it does not spark. Okay, as compared to that of arterial bleeding, and the flow is slow. The flow is steady. Okay, in case of venous. And then in case of like capillaries also, we find the same thing. The blood will be red in color, and then here we won't find sparkling of blood. Okay, in capillaries as well. And then the blood flow will also be slow, that like that of the venous bleeding, but the blood flow is more slower as compared to that of vein. That is, it will flow like a droplets of water. So are you clear, all of you?
Yes, ma'am.
Yes, ma'am.
Okay. Okay, Jivan, can you please tell me the types of bleeding, the types of hemorrhage?
Yes, ma'am. Arterial bleeding, venous bleeding, capillary bleeding, ma'am.
Okay, so tell me the differences between arterial bleeding and venous bleeding.
In arterial bleeding, ma'am, the blood spurts, ma'am. And in venous bleeding, it does not spurt.
Okay.
And the color of the blood in arterial bleeding is bright red, ma'am. and in
Okay.
venous it's dark red, ma'am.
Very good. Okay,
And
thank you.
the flow in the okay, ma'am. Thank you.
Okay. Say. The flow.
Yes, ma'am. The flow is rapid in artery and steady in venous, ma'am.
Okay, very good.
Thank you.
Okay. Samson, are you ready?
Yes, ma'am.
Okay, what is hemorrhage? What is the other name of hemorrhage?
Bleeding.
Okay, so can you please tell me the definition which I have explained?
Yes, ma'am. Hemorrhage or bleeding is a flow of blood from an artery, vein, or capillaries.
Okay. Artery, vein, or capillary, these are also known as?
These are known as
Yeah, say. It start with B.
blood vessel.
Yes, very
Blood
good.
vessel.
Okay, who is this? Who is this Bubbly? Bubbly, can you hear me? Bubbly, can you hear me? Bubbly, I think Bubbly is absent. Snee Suchiang, can you please explain about capillary bleeding? Snee Suchiang. Snee Suchiang. Otherwise, I'll pass these questions to this Dibjoti.
Yes, ma'am.
Yeah. Can you please explain the symptoms that you will find in capillary bleeding, which I have explained just now?
Bleeding from the capillary occur and wound. Blood is red in color.
Okay.
It does not form slow,
It
but
does not?
even flow.
It does not?
On
Okay. How will you diagnose internal bleeding and external bleeding? Do you have any idea? Any one of you? How will you diagnose that there is an external bleeding, there is an internal bleeding? Yes, you know now that internal bleeding, it occurs from the inside the body, and then external bleeding is from the external surface, right? From any wound that occur. So how will you diagnose that there is internal bleeding, there is external bleeding? Any idea?
No, ma'am.
Oh, Shilen, any idea? Carly?
Ma'am, it's easy to determine the external bleeding, but internal bleeding, I don't know, ma'am.
Okay, no problem. Suraksha, who is Suraksha? Suraksha, can you hear me? Balo, can you hear me?
Yes, ma'am.
Okay. How will you diagnose that there is an external bleeding or internal bleeding?
Difference, ma'am.
What? Yes, difference. External bleeding, how we will come to know that there is an external bleeding, internal bleeding?
I don't know, ma'am.
Okay, no problem. In order to diagnose the external bleeding, now first of all, like you have to assess the major external blood loss, okay, from where the injury occur externally, okay. You have to evidence it first of all. You have to evidence the major external blood loss, and then also you have to see the symptoms and sign of shock, okay. You have mainly shock, because what happened when shocks occur, when there is excessive bleeding occur, okay, internally or externally. So when there is excessive bleeding occur, then in that case it can lead to shock, okay, and shock is very, very much like danger, okay. It is a life-threatening disorder. So you, in order to diagnose the external bleeding, you have to see the sign and symptoms of the shock also, like if the casualty, that is if the injured patients or the injured person, if he or she complain of thirst, okay, if he said I am very, very thirsty, and then if he complains of blurring of vision, if he complained that like he could not see things properly, okay, वो अच्छी तरह like object या चीजों को नहीं देख पा रही है, so that is blurring of visions and all, na. We also call it diplopia. Diplopia means like seeing things, like seeing one object, like एक object को like seeing one object, how to say, in two images, one object but seeing in two images. So that kind of symptoms also is seen. And then fainting, if a person faints, okay, so all these symptoms if a person complain. And then you can also see a person face, okay, if his face is pale, if his lips is pale, all this. And like you can like check the temperature also, like if he feel cold, clammy, all these things, okay. And then if the pulse become faster, okay, if the pulse become faster but weaker, again faster, weaker, faster, weaker, like that, you have to check the pulse, okay. And then if a person complain of restlessness, means if he complain that like I feel very restless, irritated, all those things. And then if there is any like occurrence of unconsciousness, okay, if the person is unconscious, or if the casualty or the injured person is unconscious, okay, so in that case what happens is that you can like diagnose that there is an external bleeding. So let me repeat, okay. So first of all, what you need to do is that in external bleeding, you have to evidence a major external blood loss, okay, evidence a major external blood loss, कि जो blood loss हो रहा है, हाँ, कितना extent तक blood loss हो रहा है, is it minor, is it like major, you have to check that. Then the second point is that we have to check the sign and symptoms of shock, because bleeding, excessive bleeding led to shock, is not it? So you have to check the sign and symptoms of shock. So first is you have to see the if the casualty complain of thirst, if he say I am thirsty, that would be the first symptom. And the other one is blurring of vision, okay, or fainting. And the other one is the face and lips become pale. And the other one is the skin feel cold and clammy, okay, and the pulse become faster, again weaker, and then restlessness, okay, and then the breathing, there is also like problem in breathing, okay, shortness of breath or difficulty in breathing, and the patient is, or the injured person is not conscious, he or she is unconscious. So all these symptoms, sign and symptoms can indicate that a person is suffering from shock, that is the cause of that shock would be bleeding. So this is how you can diagnose. Are you clear?
Yes, ma'am.
Yes, ma'am.
Okay, and let us discuss again about.
Ma'am, can you repeat, ma'am?
Okay. Okay, so external bleeding, how you will diagnose. First point is you will check, okay, the major external blood loss. You will check the major external blood loss. And the other one is you have to check the sign and symptoms of shock, because excessive bleeding can lead to shock. So you have to check the sign and symptoms of shock. First is if the patient complain of thirst, if there is a blurring of vision, fainting, all those things, and if the face and the lips become pale, and if he or she feels very cold, okay, if the skin feel cold, clammy, all this, and the pulse become faster and again weaker, restlessness, if there is any difficulty in breathing, okay, if there is any difficulty in breathing, we also call it as shortness of breath, all those things. And then if the patient or the casualty is unconscious. means unconsciousness may occur. So that is how you can diagnose that you have like external bleeding. Okay, so let us discuss about internal bleeding. So you have to first of all assess the history of sufficient injury, okay, to cause internal bleeding. So uska kya kya injury ho raha hai, all this first of all you have to like assess the history of sufficient injury, okay, that cause internal bleeding. Uska kya injury ho raha hai that led to cause internal bleeding. क्या इंजुरी का वजह से उसका इंटरनल ब्लीडिंग हो रहा है, that you need to check, okay, whether he or she hit the skull or not, she hit the abdomen or not, all those things you have to check it, okay. So that was the first point, to check the history of sufficient injury, okay. And then again you have to check the wounds that have penetrated the skull, wound that have penetrated the chest or abdomen. All these things you have to check, and you have to check the history of any kind of like medical condition, okay, which may cause internal bleeding. जैसे कि what example we like? Medical condition means like if there is any ulcer, क्योंकि ulcer का वजह से भी bleeding हो सकता है ना, ulcer, you know ना what is ulcer? It's like inflammation. So उसका वजह से भी internal bleeding हो सकता है. So you have to assess that. And then if there is any pain and tenderness around the affected area, swelling and tension may be felt. All these things you have to check. And then again, the same thing like that of the external bleeding, you have to check the sign and symptoms of shock, okay? All those things. If there is any fracture of bone, okay, especially your long bones of upper arm and thigh, all these you have to check internal bleeding. All these are like not necessarily for your this current course, okay, but as we are talking about the hemorrhage and we are discussing about the bleeding now, so I just want you all to have a little bit hints or knowledge about the external and internal bleeding, how bleeding occurs. But in your syllabus, like only the types of hemorrhage and about the hemorrhage is required. So are you clear?
Yes, ma'am.
Yes, ma'am.
Okay. Jivan, please take attendance. Okay, only 10 minutes left.
Okay, ma'am.
Okay, do you want to ask any question? Anyone? Any question? Anyone?
No, ma'am.
Okay, so today I have 2 classes now. After this class, and I will inform you all when to join again.
Ma'am,
Yes, say. Who's that?
can you please
Yes,
can you please explain
Pardon?
in
Speak loudly, speak loudly.
can you please explain internal bleeding again?
Oh, internal bleeding. Oh, internal. Okay. There is only 7 minutes. Internal bleeding means the bleeding that occur from inside your body. Okay. So first of all, you have to check from which side injury occur. Sufficient injury. Okay. You have to check the history of sufficient injury that cause your internal bleeding. And then you also have to see there is any like medical condition, okay, which cause internal bleeding. कुछ medical condition है क्या जिसका वजह से उसका internal bleeding हो रहा है, जैसे medical condition like ulcer, all those ulcer, inflammation, all those you have to check. And is there any pain and tenderness around the affected area, means swelling and tension, okay, all this may be felt. And then sign and symptoms of shock, same thing that I explained in external bleeding, that same thing you have to you have to assess or check it, okay. And then you have to check if there is any fracture of bones, especially long bones, okay, long bone of upper arm as well as thigh, all this you have to check it. So those are the like how you can diagnose the external bleeding as well as the internal bleeding. Are you clear, Aliza?
Yes, ma'am.
Okay, next you will be having your practical class. Okay, I'll inform you the time, but I'll try to take before this, or else I'll start at 11:30. Okay, then for now, that's all. Okay, thank you, everyone.
Thank you,
Thank
ma'am.
Thank you, ma'am.
Thank you, ma'am.